Hi, I'm Dr. Agyaram and today I will tell very important topic uterine fibroid. This uterine fibroid or fibroid in uterus occurring in aged women or women is above 30 or 35 or 40 or in menopausal age and very common for pelvic tumor or benign tumor in women and fibroid occurs in smooth muscles of uterus. So I will show you in picture. This is uterus. So this is fallopian tube, this one is ovary, this one is uterus, this full part is uterus and this is vagina. This is the genital part of woman or we can say reproductive part of woman. So this part is uterus, this is fallopian tube, this one is ovary and this one is vagina. So this fibroid occur in smooth muscles of uterus. So it can be anywhere in this area. So like somewhere here or here. Either single or multiple more than one. So this is called fibroid. So here I told you definitions or we can say introductions and then cause and third is symptoms and fourth is preventions and treatment. So cause for fibroid uterus or uterine fibroid. So use of sex steroid like progesterone and estrogen hormonal tablet or medicines which is used in excess quantity. So that is causing fibroid and menopausal age or aged as I told is above 35 or 40 or in like going to menopausal age this fibroid may occur and repeated abortions causing injury in uterus and later they are causing fibroid and other factor like environmental factor obesity if they are obese so there might be fat also can cause and vitamin D3 deficiency. So introductions cause and symptoms. What the symptoms is going to see in uterine fibroid? So non-cyclic bleeding. You'll see the bleeding during period, but this fibroid like bleeding will be more or heavy bleeding. So as a normal period is they are getting bleeding 3 to 5 days or 6 days or sometimes 1 week also, but generally because 3 to 5 days bleeding. But in this condition, bleeding will be more like continuous for 1 week or 2 weeks or heavy bleeding and pelvic pain. They will usually get pain in pelvic area and dysmenorrhea, painful bleeding. When they'll get the period, they are too much pain. They are not able to bear the pain and non-cyclic pain. These pains continue after period also. If period is over, they will pain will continue and some other symptoms like urinary symptoms. So they will feel is repeated urinations or pain during urinations. So these symptoms and how you will see that is there fibroid or not. So you have to go with a simple scan. We call pelvic scan, or USG pelvic. Or sometimes there is a small size of fibroid, so you cannot detect. Then you can go with CT pelvic. So CT scan of pelvic area. So they will detect either fibroid single or multiple, or what to do or what not to do. And then is preventions or treatment. So before surgery or before going for a surgical removal, they are trying with medicines. There is few important things which you need to follow, like reduce weight if you are you having obesity or you are overweight. And second, do not use excessive steroid or sex steroid or any contraceptive medicines without your doctor guidance. So if you are taking medicines like oral contraceptive like Mala D or Mala N or any progesterone or estrogen medicines, you should take with gynecologist opinion, or you can take with your doctor opinion. So you should continue how long they will tell. And third, medications. So if bleeding is more, giving hormonal treatment to reduce the bleeding and to normalize the cycle. And oral contraceptive medicines or combined medicines to use for fibroid and to reduce the symptoms. And other symptomatic treatment like for antispasmodic or painkiller to reduce the pain, and other symptom like urinary symptoms depend on the symptoms, treatment will be continued. And some supportive uterine tonic which affect or which give the good result. And last one is surgery. So surgery name is hysterectomy. Hysterectomy. So surgically removal of uterus. So they will remove this area, and this is removal of uterus is called hysterectomy. So this is the permanent solutions for fibroid, because medicines works very rarely, but the surgery is the best choice and best options for fibroid treatment. And one more thing I will tell you, in India, as you know, a lot of women or many women, they won't come to doctors or they won't visit to a gynec doctor for their problems. They will wait, they will take medications from pharmacy, and later it become more, they will come to doctor, and at the end of the solution will be hysterectomy. So if you have any symptoms, uterine fibroid symptoms or any gynec symptoms, please visit earlier to your doctor or gynecologist so they can detect early and they can start your treatment. And thank you for watching. Thank you.